Sir, your voice is not unable to.
Hello, is it now I am visible?
Yes, sir.
I'm audible. Okay. సో ఏప్లేషియా వినిపించిందా? ఏప్లేషియా చెప్పాను. హలో.
Last few lines వినిపించలేదు.
Okay. Aplasia, uh, like aplasia is nothing but the absence of salivary glands. During the development, what happens? Some glands may be completely non-developed or missing. That is known as complete non-development of the salivary glands. So, which can be seen using the CT scan or MRI images. You can see that the glands are absent. Like for example, one side of the submandibular gland may be present, one side it may be missing on the left side. So those conditions can be histologically identified, or using CT and MRI, you can identify that the salivary glands are missing and they are replaced by fat or fibrous tissue. That space is filled with these fat and fibrous tissues. And this agenesia or agenesis or aplasia of salivary gland is commonly associated with certain conditions or syndromes like hemifacial microsomia, Lat syndrome, manubulofacial dysostosis, also known as Tricker-Collins syndrome. These syndromes, they are seen. And usually when major glands are missing, what happens usually, the amount of saliva produced is reduced. When the amount of saliva produced is reduced, you can have a condition known as xerostomia, which is also known as commonly referred to as dry mouth condition. The mouth becomes dry. When the saliva is reduced, there is no saliva in the oral cavity, the mouth becomes dry. So that is known as dry mouth or xerostomia, one of the main conditions that can be due to the malformation of salivary gland, non-development of salivary gland. When the salivary glands are not properly developed, they don't function properly and they don't produce the saliva in the normal quantity. When the normal quantity of saliva is not produced in the oral cavity, the oral cavity becomes dry, and that will lead to many other complications. That is why xerostomia or dry mouth is not considered as a disease. It is not a specific disease. It is a symptom of certain disease. Any disease can finally lead to any disease associated with salivary glands, which can affect the quality and quantity of the saliva produced, can ultimately lead to the condition known as xerostomia, dry mouth conditions. So this etiology, it can be temporary condition or permanent condition. As I have told you, when there is complete absence of salivary glands, very rarely major salivary glands are absent. The amount or quantity of the saliva produced is reduced, that leads to xerostomia, or it can be a temporary condition due to some conditions, some situations. So these are, so on the whole, you can divide xerostomia as temporary or permanent. Temporary reasons for this xerostomia are psychological disturbances, duct calculi. Whenever duct calculi commonly refer to salivary gland stones, you call it as salivary, major salivary glands. If you remember, they have a duct, excretory duct, Bartholin's duct, Stenson's duct for parotid gland, Bartholin's duct, like that. Whenever you have these major ducts, these ducts sometimes get calcified with calcifications known as salivary gland stones. Whenever you have the salivary gland stones, they will prevent the flow of saliva. Normal flow of saliva is affected, leading to dry mouth condition. That is one reason. And similarly, sialadenitis. Sialadenitis is known as inflammation or infection of the salivary glands. Whenever there is an infection to the salivary glands, then you have this sialadenitis, and because of which the amount of saliva produced reduces. And again, you will have this xerostomia condition. And one more fourth reason is drug therapy. Certain drugs, especially these anticholinergic drugs and sympathomimetic drugs, they have this, they act on the salivary glands and reduce the flow of saliva. The amount of saliva produced is reduced, or saliva becomes thick in some cases, which leads to dry mouth condition and leads to other problems. So these are some of the temporary problems that can lead to xerostomia, psychological